Mic test, 1 2 1 2. Mic test.
Good afternoon, everyone. Welcome to the Tarrant County Hospital District. What are we in, September now? September meeting. Thank the board members for being here. I heard from Dr. Holland. She couldn't make it today. And Tim Davis not only plays a lawyer on TV, but one in real life, and he couldn't make it today. So we will excuse them for being here. So we're going to do our opening prayer. Before that, I just want to say we're going to do our prayer. Angela's going to lead that. I want to take a few moments of silence to remember September 11th. This is a building that is full of first responders and is often called upon to take care of those in the most stressful moments in serious trauma items. And just as a show of reverence to our country and to the victims and to our heroes, I just want to take a few moments of silence, and then we'll do the Pledge of Allegiance. Angela?
Gracious God, thank you for each mind and heart that fills the presence of this room. As we discuss our ongoing business, clear our minds of distractions as we focus on this important work. We have the talents, abilities, and the time. So please lead us to function as a collective, making decisions that are right and just for JPS and the communities we serve. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all for that. Thank you, Angela, for the prayer. I've got a few items here on the board chair report. Don't know where to start. I always make notes, but again, I can't read them. Should have been a doctor, huh, Dr. Casey?
It's the second person who's made reference to physicians.
Well, I'd be an attorney, but somebody does that for them, so. It was a busy month. It has been a busy month, as it always is with budget, and I want to thank Dustin joined myself and staff as we presented the budget to the Commissioner's Court on the 4th. We appreciate you being there for that. Just a reminder that the court will vote on the budget as presented on the 17th meeting, I believe, and then we'll roll into the new fiscal year starting October 1st. So we're excited about that. Also, I don't see Joy in here today, but Joy, Dustin, as well as multiple members of our staff here at the main hospital, as well as members of the staff at the Northeast Clinic, joined me, and I have a lightsaber, and do I just push a button? Mm-hmm. Yes. The Six Stones grand opening was held Tuesday of this week. As you can see, this is on land that JPS sold to Six Stones that is directly adjacent to the Northeast Medical Home. And there was about 500 people for that grand opening. This is a picture, my wife Shannon and I there. And also you can see inside this new Hope Center is basically a really scaled down version of a grocery store. So instead of clients coming and us handing them a bag of food of something they may not want or may not eat, or a box of starch, they can actually take a real life shopping cart and go through the store, get the items they need, including fresh meats and fresh vegetables and fresh fruits. And for some reason, we had some of the biggest carrots I've ever seen in my life. I don't know where those came from. But, with Six Stones and JPS being next to each other, certainly there in Northeast Tarrant County, only good things can happen. And I am appreciative of the board's support for that project and moving that forward. And we're really excited to see. It was fun to see as the remarks were happening staff members from the clinic were coming over in little waves in between patients and checking in and taking tours. So it was an exciting day. So
Who funds that?
that is funded, multiple ways and through various programs, but most of that money is private money raised. Some of the programs, the back to school programs are help funded through the county and through the cities, and then the home revitalization program is funded through the cities and through the county, as well as companies like Lockheed Martin, BNSF, and large corporations. But you can go to sixstones.org and look at all the things that organization does, including the new Momentum program, which is job training and mentoring, and there's a computer lab in there. There's all kinds. It's great. And I'm excited too. I don't know exactly how the LVT Rise and that community center is going to work, but I would imagine that it's something very similar, and that's well under construction in conjunction with Cook Children's. So we're excited about that. I believe at the end of the meeting, some board members have left and most of the crowd was gone, that I wanted to introduce again Ashley Sanchez, who has joined, who will be working closely with the board as the new board coordinator. Ashley has valuable experience in the medical community, including her previous role as administrative assistant for the JPS Community Health, as well as a strong background in patient care, including serving as a medical assistant on the surgical trauma unit at the Pavilion, as well as the critical care unit at Medical City. So Ashley, welcome again and thank you. And you joined right around budget time, so that makes you stronger. There's no doubt about it. Ashley is joining us following a promotion of her predecessor, who you all know well, Lonnie Taylor. Lonnie's excellent and strong work organizational skills quickly caught Daphne's eye, who she reports to, and having proven herself as a valuable and dedicated team member, she was promoted to the role of legal operations manager. So although we won't be interacting with Lonnie on a day-to-day basis like we will Ashley, we certainly wish her good luck and thank you for your hard work. And listen, if you can keep the 11 of us organized, you can do my job, that's for sure. So thank you for that. We often don't get to speak too much about legal because they're usually fighting battles or keeping us all protected in different ways. And our legal team, and I'll be the first to admit, when we went from outside counsel to in-house counsel, I was not a fan. I did not like that policy change. And I will stand up, because when I am wrong, I will stand up and say I'm wrong. When we found Daphne to fulfill that role, you made all of my fears that may not have been rational at the time completely go away. And I want to thank you for your leadership in taking over that department, saving that department money, and really doing a fine job for us and representing the board, and serving in that dotted line capacity. Oh, yeah, that's right. I forgot. Was that today or yesterday?
It was Tuesday.
It was Tuesday. Oh, that was right. It was because it was the Six Stones opening.
Yeah.
Well, you know what? I got you some banana cake out there in the garden.
6 stones left over.
Happy belated birthday, Daphne. But I was also made aware that Daphne's very quiet about her accomplishments, but this past year she has been featured in Modern Healthcare and received awards honoring her as a top general counsel and a powerful and influential leader. So we are very proud to have you, and thank you for your service, and keep it up. And nobody likes orange jumpsuits, so we appreciate what you do. So, especially Blake. Tim is a Longhorn would actually like it, and Amanda, so. But anyway, thank you for the work that you do, and your entire department does.
Thank you.
And Ashley, we promise we will be nice. I promise you. Finally, continuing education is a requirement of our physicians and our leaders and everybody else, and it's also a requirement actually of this board. It's kind of been pushed aside a little bit because of COVID, and many of those things just weren't happening. But I wanted to let the board know that there is an October leadership conference being held in town at the Ritz-Carlton in Dallas. That's October 16th through the 18th. I've got 2 packets of information, and we can get you more and send it out in the email. But if you want to look at those, if any of these seminars interest you as a board member, we can get you registered. You don't have to travel too far. You do have to go over there. I'm sorry, but it is a local conference, and there's, as these seminars go, there's many, you can kind of pick the class you like and check that out. So that's October 16th through the 18th.
Roger, question. If we have to go to Dallas, can Neil pack us a sack lunch?
Yes. We'll
Take it with us?
Yeah, we'll get you a sack lunch, and we'll have a security guard take you, so.
We will drive through Chick-fil-A.
Yeah, there'll be a Chick-fil-A, and we'll take the express lanes and make it as painless as possible. So anyway, that's all I have. Dr. Duncan, thank you. Thank you all for your time.
So thank you, Chair Fisher, for your update there. I do want to congratulate Six Stones on their opening and the great work that they're doing that does align with our mission and the work that we do. So I know that partnership will continue to grow. I also want to thank you, Chair Fisher and Mr. Austin, for being there at the court as we presented our budget. Believe it or not, that does offer us confidence when we have our board there with us. And so I do want to thank you for that. So with that said, let's get loud. And I can see. We actually got it. Hey, Derek. Wow. We finally got it right. I did send the board notification of a great individual that will be joining our JPS team here. Leah King has now been named president of the JPS Foundation. Yay, this is great. Great news. Many of us know Leah through her work with United Way of Tarrant County, where she served as both president and CEO of that organization. Leah comes, as you know, with strong community connections and has an amazing ability to tell the stories to the community and to raise money based on those stories. And so it gives us great pleasure, and I do want to thank Shannon for leading that national search that led to someone of Leah's caliber to come to JPS, but I think it also speaks of the board, of how great of a board is, how great JPS leadership team has, and the staff that works here, and the culture that we have, that we're able to continue to attract top talent. So we will have Leah join us in October. She'll take some much needed time away with her husband as they do some travel and as she finishes up at United Way. So great news. We also, we'll have our first White Coat Gala. Many organizations, their foundations do have these annual White Coat Galas that recognizes the work that our physicians do for the organizations. We do understand that at the end of the day, they often are at our front line alongside other staff to care for our patients. And so this is opportunity for them to come out, to have a good time. I understand that Shannon, who has included our physician leaders and physicians within the organizations on the planning of this gala. She met with them last night. I called her, I think it was about 8:30, and they were just kind of finishing up, so our physicians have been very excited. But they voted that they wanted this to be black tie, and so we will be a black tie event. This event will be held October 19? Okay, there's so many things going on, but October 19. The event is nearly sold out, and there was a goal as far as monies raised as part of sponsorship, and we have surpassed that goal. I do want to thank Dustin and Amanda for their contribution that they have given to support this event, and would encourage all of you before these tickets are sold out to find opportunity to buy a table or to support this event. So look forward to seeing all of you there. I had opportunity to meet with the executive team this morning, and we all are committed to have 100% giving from the executive team to the foundation. And so I will challenge the board to also have 100% of their members give. We do know that organizations that have given to JPS, or just in general, when foundations are going out and asking for support and monies, especially as it pertains to capital campaigns or supporting programs, they often want to know what percent of your employees give, what percent of your board gives, what percent of your executives give. That is meaningful. It's not the amount, it's the fact that someone, and we all give something, whether it's volunteer time or dollars, to organizations that we're passionate about. So it's not the amount, but it's often the fact that you find that organization that you serve in some capacity, that it is an organization that is worthy of being given to. So as we set the foundation for Leah to come in, we'd like to say to her that she can go out and continue to raise money and know that the leadership and the board at JPS have given 100%. And so I will challenge the board like I've done the executives, and I think we're close to 80% of the executive team. So, and I want to thank those who have given and contributed to our foundation. So I'm going to ask Joel Hunt to come forward. Over this next fiscal year, I'm actually going to bring the community to the board. I think we often speak about what goes on here at the hospital, and there is... Oh, you're going to give it to Joel? Oh, okay. I was getting ready to say, am I finished?
You've lost your lightsaber.
There is a lot of activity that goes on here, but a lot of the important activity actually goes on out in the community. We would be much busier if it weren't for our community sites and the work that's done out in the community that keeps that care out in the community closer to our patients, and that's exactly what we want. And so over the next year, we're going to bring the community to you to hear about the great work that's going on outside of the home base here at JPS. Joel Hunt, for those of you who don't know Joel, you'll introduce yourself, so I'm not going to speak to the number of years you've been here, but you've had a lot of experience, we know, in the street medicine program. I know you came here to JPS having had experience elsewhere and done an amazing job in overseeing the acclaimed street medicine program. Joel has coordinated programs that address the care of those who are experiencing homelessness, and he has been able to reach those individuals, whether it's in parks, whether it's on sidewalks, whether it's under our bridges. He often is asked by those here in the organization, and most recently from the foundation board, can we go alongside you? And that is an amazing experience for anyone who has had opportunity to accompany Joel as he heads out in the community and to help those who may be experiencing homelessness. So Joel, I'm going to turn it over to you, but I want to thank you. When I first came here and it was over community services, I probably spent more time than any of that team wanted me to out at True Worth, but was truly amazed with the individuals that provide care. I know that the foundation has supported you in that van for a number of years. Joel was out on foot, and we were able to give him a van in which he's equipped in order to be able to provide some privacy for that individual and also provides higher levels of care. So with that, I'm going to turn it over to you, Joel, to tell us a little bit about yourself and then share the street medicine program.
Thank you so much, Dr. Duncan, and thank you, board, for allowing me to be here today. So street medicine, I came in 2014 in November. I was the last person to get hired for the street medicine team out of the DSRIP 1115 waiver funding is how it got initially started. And since that time, we were on foot in our own cars and have been able to move along with some maturity in resources, and but the mission, the work has stayed the same. And one great thing that I also really love about being here and what we've been able to do is really increase the amount of opportunities for education for learners. We have a track for the family medicine residents for street medicine where they can do 2 years longitudinal care over their residency and can do a 4th year of focused on street medicine. We also have a fellowship, and this is very unique for the country. So I'm very excited to have that. But let's go on. I just want to say all the pictures were with permission. So if we feel like we're just one, or we are one part of the broader services that JPS provides to people experiencing homelessness. And this is just a graphic to kind of give a bird's eye view of those services. We have a clinic down on in Lancaster in the shelter area, recuperative care, which is a program where people can discharge from the hospital that don't have a home or even a regular shelter bed to go where they can recuperate from usually surgeries, and are seen by a team there. Intensive primary care, who goes after people who use the emergency services a lot, and a lot of those are people experiencing homelessness. Talked a little bit about the learning programs. That Housing First is a housing program that we collaborate with, and then us, street medicine. So street medicine, what is it? It is a practice and an ideology of meeting people literally where they're at, both figuratively and literally, and bringing care to them and helping them back into the mainstream services of a healthcare system and getting the resources and care that they need. We do that with a host of people. It's not just one person or even just our team that can help make this happen. See the no trespassing except JPS. Except JPS, that's right. So we go anywhere in the county. Truthfully, we are generally within 820, except for a few exceptions, because that's where the concentration is. And we go wherever, woods, parks, everywhere, and bring healthcare to them where they're at. And we have a schedule that has some dedicated areas and times, but we also keep it flexible because there's so much movement that it's very difficult to meet the patients if we're not matching their flexibility. And the why is bridging the gap. And to that point, one of the biggest gaps is that just navigating the healthcare system. Obviously also medical care and then connection with the rest of the community and resources. So healthcare navigation, we help them access JPS connections, help them if they would qualify for other benefits like Medicaid, Medicare, disability. We help them connect them with the right people that can do that. Just planning appointments, helping them figure out, troubleshoot how to get places, trying to coordinate transportation, which is a real challenge. And then working, of course, with other departments within JPS, but also social programs for referral coordination. Medical care, I'll go into just briefly a little bit more detail in the next slide or two. What we do, probably our bread and butter calling card is chronic disease management, ongoing chronic disease management, not a drop-in urgent care kind of model, but actually following these patients and becoming their primary care provider in their medical home while we're with them. Preventive care is a big part of what we do. In mental health care, behavioral health care, we do a lot of that. And here's some of those specific programs. MAT is medication-assisted treatment, which is for people with chemical dependencies like alcohol or opiates, and using medications to help treat that, which has been such a boon to be able to do that over the last few years. Hepatitis C, we can screen and treat that right on the street, which is maybe one of the most mind-blowing things, because years ago it was like chemotherapy. Now it's not that big of a deal. HIV prevention, with some medication as well as education and condoms. And then we have some of the sports medicine physicians that come out with us, which is also incredibly helpful given the nature of the wear and tear on people's bodies. The community connections, so we're just one cog on the wheel in the community for helping these individuals get out of their situation. So we work very closely, sometimes literally elbow to elbow with some of the social service providers like DRC, sometimes with some of the HOPE teams, fire and police, Tarrant County Homeless Coalition, now called Partnership Home, and some of their employees as well. So that's a very close collaboration we have with them, and we refer back and forth for those services. So that is it as a whirlwind overview of what we do. There is a video that we're going to play from a few years ago. Channel 11 did a little story on us, and the setting, if anybody's familiar with that area, is on Calmont and Cherry, kind of where there's a new school there, is where this is filmed.
Last year, JPS Hospital in Fort Worth saw over 17,000 visits to its emergency room, specifically by the homeless in Tarrant County, which number about 1,900. Those visits didn't really rise, all of them, to the need of an ER visit. Still, each costs about $1,300. But tonight, only here on CBS 11, we're on the streets with a really unique team at JPS making house calls to the homeless, and it is making a difference.
Jerry, how's it going?
Well, I'm doing well. Thank you.
Doing okay?
It's a house call
I was a little bit tired. I rested some, so I'm back up again.
aimed directly at those who have no real place to call home.
Pressure's a little bit low, man.
It is.
4 to 5 days a week, former Army combat medic and physician's assistant Joel Hunt and his team at Care Connections Outreach at JPS hit the streets with bags filled with medical basics and a healthy dose of compassion.
Any lightheadedness, dizziness?
This version of street medicine at JPS was born back in 2014. It's a pretty simple concept. Basic health care out here can dramatically reduce visits to the emergency room. Reality for you guys is that you're either going to see them proactively with you coming out here, or they're going to come into the ER.
Correct.
They're going to use resources in the ER, they're going to use beds in the ER, they're going to use medication, doctor's time, nurse's time, right?
Right.
Which is much more costly there than you coming out here.
Absolutely. Okay. Just schedule him for Kyle.
The homeless house call is much like an office visit.
Are you having pain?
Notes are taken, charts are kept, prescriptions are written, and there is accountability.
Are you taking your blood pressure medicine?
I've been taking it.
Do you take it in the mornings? Or?
I take it whenever I remember it.
And when needed,
So it's a kind of a traumatic toenail avulsion. She had her kind of knocked her toenail off, it sounds
With
like.
an axe.
With an axe.
the street team takes care of scrapes, cuts, and small infections.
And so something like this, it goes untreated. There's no access to health care. Seems incredibly simple.
But it's something that could turn pretty ugly pretty quick.
Pretty bad.
The mission to bring health care to the forgotten in Fort Worth is a passion for this team. The payback goes far deeper than the dollars that might be saved.
I get to bring a human touch. I get to look people in the eye that don't get looked in the eye very often.
I have to imagine that this means a lot for you, for these guys to come here to you.
Tremendously, it is. It's a great deal of help for all of us, but we all need them.
So this all goes so far beyond just the basis of medical care. Relationships are also being formed and built here that helps them lead to a part of the program that helps the homeless get ID cards. And Gilma, that's a key component. The ID card can lead to eventually to housing, which is something they all desperately would love to have in many cases. Not all of them, but a lot of them would.
So much more than just health care.
Absolutely.
And Doug, have we been able to measure whether this program is really working when it comes to actually saving money? We know how costly it can be to go to the ER.
Oh, yeah. I mentioned at the top, $1,300 a visit. I mean, just a regular visit into the ER. So the short answer is yes. So here's what they did. JPS last year tracked their highest users of the ER among the homeless. These are homeless who visit more than 50 times a year each. Joel and his team brought the street medicine to a number of those specific high users, and since then, among that group, they have been able to measure a 33% drop in the amount of visits to the ER. So dollar for dollar, going out and getting to these people in advance, it's a win for everyone. And the hospital financially, the homeless out there. But the last piece of great news that I just got, literally, I got a phone call 15 minutes before we went on the air. The woman you saw who had the toe injury,
Yes.
they call her mama. She's been homeless for 20 years. I was told 15 minutes before air tonight she got housing.
That's wonderful news. That's wonderful.
All comes together, doesn't it? It's pretty incredible.
Thank you.
So I'm going to open it up to any questions that you may have of Joel, but I think this is something that to be proud of. Joel is known across the nation. This is not just something that has been kind of built here in Fort Worth, but he is asked to speak across the nation about the great work that's going on here. So Joel, I can't thank you enough. I think this is something that the community would spend money on and be very proud of. And you did not stop at just giving them, a prescription or fixing the avulsed nail at all, but you took it further and actually for many of them give them hope. And so thank you for all that you do. So I will open it up to the board for any questions or comments.
Question and comment. Can I book them for a certain time? I'd say that because once a month we, in connection with Tarrant Area Food Bank, we give away groceries. And we average about 400 to 450 that every Thursday. But a lot of persons come through there are homeless and they're pushing carts. And I think it would be a good time to see if I could work out to come through there and maybe visit, see if there's any health needs at that time.
Joel does have appointments just like any other physicians and they wait for him. So Joel, I'll let you in.
Absolutely. We can connect and get more information on who we need to reach out to.
I can. Yeah.
But I would love to learn more about that for sure.
We're not far from True Worth.
Okay.
If you haven't been to True Worth, you owe it to yourself to visit True Worth Clinic because it's awesome. Okay. Trent and I were there when and Dorothy when they first opened.
That's right.
Okay. But we're not far from True Worth, my church, where we do it. Okay.
This is anything we do in this organization. So first of all, thank you. But secondly, what does the future look like? Where do we go from here? I mean, you have pioneered this in Fort Worth, but it is a model. So my question to you is, as a board, what do we do to help you next? Where are we
Wow. I think being able to, because we're not able to meet the need. So expanding the services, which generally means people, we're pretty light in terms of supplies and that kind of cost, but expanding the footprint that we can cover and finding a way, trying to work ourselves out of a job is really the ultimate goal, and really increasing the connectivity with other community partners, whatever that looks like. And there's a lot of ideas that I have, but so that some of the access to resources that gets them out of the situation, gets them connected with housing, and that is not a straight line kind of process, that would be really, really helpful for expanding the services to the people.
Well, I hope the board gets that opportunity to look at those needs and be a part of that solution, because we've supported it. We've supported it financially, we've supported it emotionally, but whatever it takes to give Joel and his team what they need, I hope that those opportunities get to the board level.
Thank you. I know Joel appreciates that. Joel, do you want to speak a little bit about, since we've talked about Leah joining our foundation, and you've already been in front of the foundation board and Trent, that same question was asked, so we truly do appreciate it, and we do see the importance of this. Do you want to just speak about how the foundation has helped this program?
Absolutely. We would not be able to do what we do without the foundation. trying to summarize the past 10 years is kind of difficult. So this last year, we've been able to, or the foundation has gone after and received $140,000 in donations that helped, or in grants from the Hillcrest Foundation was $100,000, and Epic was $41,500 that helped secure go towards the purchase of our new mobile health unit that just got in 2 weeks, a week and a half ago, which will be absolutely phenomenal to have. And I think you said it, Dr. Duncan, a place where we can take people and have those conversations that are harder to have in the natural environment, and do some screenings and preventive care and some procedures that are better in that kind of environment. That'll be amazing. And just this summer, $20,000 worth of supplies for, it sounds so simple, and it sounds like it just sounds simple, but it's water, socks, bug spray, hygiene kits. It's simple until you don't have it, and then it turns into a real problem. And Dr. Casey can probably talk to the volume of dehydration-related ED visits, admissions, and ICU stays that we have, and it's not insignificant. And access to water is not. It is a challenge in Fort Worth, in every American city, really. Every street team has this problem. So that monies and those supply items are just incredibly helpful, and we couldn't do it without them. And we've had I think it's over 1,200 gallons of water that we've handed out. I think the data was just this summer, or maybe since January. So that's incredibly powerful.
Joel allowed me to tag along after me asking for 10 years and I got to go in late June, and handing out water was things like that, and I think he offered for folks to go with him, and I would strongly encourage it, because it's little problems like that we don't think about naturally until you see there and you're with them. And I'm looking forward to my next time. And on the video, some of the impact he saw, there was one of the physicians he helped train, Kyle Patton, who's now leading the same program in Northern California. And I visited in a similar place in South Bend this summer, and Joel is nationally known. And there's so many of my residents are so interested, and he takes them under his wing, and we have a lot of opportunity. We have a lot of resources to grow it. But until you're there, and once you're there, you don't see the world the same.
Blake?
Yeah, hey, Joel, can you explain a little bit about how the staffing works for the street medicine program? Is it volunteers that rotate through that have other jobs at JPS, and then what sort of schedule do you have? How often are you doing the street medicine during the week or a month?
Yes, sir. So the staffing, the sports staff, everybody's employed. So we're all employees of Acclaim. So we have two community health workers. One is also our mobile health coordinator. And we have a social worker and a nurse. And that's the full-time staff. And then currently we have 17 family medicine physician residents that come out with us that really bolster our services. We have 2 sports medicine physicians that each come out half day a week. We have a family medicine physician from Trueworth that comes out every Wednesday morning. One of the graduates of our street medicine track that's going to be at Viola Pitts is going to be out every Friday morning. And then another graduate that's doing the arms clinic is going to be coming out periodically to help with procedures. And then some of the ED physicians come out, 2 of them, Doctors Holmes and Scarborough, come out periodically as well. And so that's the staff. And there was another question.
And the
schedule. So we split the county in half by I-30, so that's north and south, and then central, kind of just downtown, bordered by the rivers and Rosedale, I think. And so we do, every morning is scheduled either north of I-30 or south of I-30, 2 days a week. Monday and Thursday are north, Tuesday and Friday are South, and Wednesday is Central. And so we have a rotating schedule of, or a fluid schedule, I should say, of the patients that we're seeing and following, and we go over their names every morning and determine, based on all of our understanding, awareness, their utilization of JPS and some of the other community services, who needs to be seen first for what. There's always way more people than we can see. And so we create a who's patient number one, where are we going to go, and then go about our day that way.
So like 5 days a week, you're
Sorry,
somewhere?
5 days a week, yes, sir.
Okay. Somewhere in the county, the street medicine team is taking care of people?
Yes, sir. And then we do a couple fixed locations, ones at First Street Mission downtown with the First United Methodist Church. We do that a couple half days a month. We do it with one evening outreach with Love and Light Ministries in Glenwood Park, where Love and Light Ministries has a whole bunch of services, kind of a pop-up, and we just co-locate there with them as well. And there's a couple others I'm forgetting right now, but.
Thank you.
Yes, sir.
Anybody else have anything? Joel, I want to thank you. Is mental health evaluations part of that rotation of physicians?
Mental health evaluations?
Yeah, or behavioral health, are they involved in any of these rotations?
Like the psychiatry residents? They are somewhat, and we're in conversations right now to figure out how to get them more involved. There's plenty of work to go around, for sure.
I think it's great, and it's certainly, if that's a 2014 news article, I think that we probably need some more of that, just to highlight it. Oftentimes, especially this time of year, where there's a lot of talk about taxes, and taxes are often seen as buildings or monuments to public money and whatever else, and high-paid executives and whatever else. But oftentimes, the patient is not noticed in those conversations. And I think personally, there's no greater testament to public health and to the work that you guys do every day by that sign that says no trespassing except for JPS outreach. And kudos to you and your team and to JPS and what we do here daily, not just within the confines of the building or the confines of a medical district, but throughout the entire county, reaching out to everybody, and that is really remarkable. So congratulations.
Well, thank you very much. I have immense gratitude for JPS, because my story here at JPS is one full of support. That is not often the story of street medicine teams around the country. So it is unique in a lot of ways, and I have been able and super thankful, fortunate to be working with such an amazing organization that's been so supportive.
And I echo Trent's comments. If there's policy changes or things that need board support, let's see it, and let's see how we can work it out.
Appreciate that.
Yeah,
Thank
you're
you,
always welcome
Joel.
to come with us.
All right.
North Texas Giving Day, it seems like it comes quite often, but it's coming up soon. And the monies that we raise here at JPS will benefit Joel's homeless program.
I was going to ask, as far as it pertains to board giving, is it better for us to do it through the North Texas Giving Day portal because those are matched to a percentage, or just take our money?
Shannon would tell you both.
They have additional fees that come directly to us, and so for services and programs, but we take both.
Okay, all right, thank you. Okay, so you can earmark the funds on the donate to JPS.
Yes, it does. Tables for the gala does count towards giving. And thanks, Trent, we just got your donation. Thank you.
Hey.
Okay.
Roger.
Yes, sir.
Can I make a couple comments?
Please.
One is when you talked about the workshop in Dallas, I would suggest, and we discussed this some time ago, the THA that we used to attend prior to COVID, that the board would look at get back to attending that conference. It moves around the state. I know when Dorothy and I had gone, and Trent, you get a chance to see what's taking place around the state when it comes to hospitals and medical facilities.
I'll ask Ashley them to keep an eye on further board governance and training opportunities to make sure that we're either regularly or notified about when,
Right. We
when
just
those
missed the
happen.
state because it was in late part of July, but I know it's when the annual board.
Okay, yeah, thank you.
The other thing is I just want to say to Dr. Duncan, I formerly served, I did a term, 2-year term on the board of directors for United Way. And the selection of Leah King to you and Shannon is awesome. Somebody who can help the foundation and then also expand the message of JPS. Leah King is that person. And so I just want to mention that.
It's an exciting time for the JPS Foundation, for sure. Okay, well, I've never been really great at following rules, and I broke the agenda, so I'll get us back on track, so I apologize to everybody about that. Are there any citizens wishing to address the board? Seeing none, we'll move to the approval of the minutes. I just want to make a note that if you saw the minutes in the portal, there were a few minor corrections made. Those are reflected in your iPad book today. They were minor, who moved, who seconded, et cetera. So with that, this would be approval for the joint Board of Managers Finance, Planning, and Investment Committee meeting of August 22nd.
Move approval.
A motion and a second?
Second.
Any discussion?
Yeah, I have a discussion.
Yes, sir.
Daphne, did you get my message?
About
No, the motion and the second on the one issue.
So that motion and second was valid because it was a joint meeting. So as long as there was a quorum of the board present and they approved, then that item was approved.
Okay, thank you.
Any further discussion? All right, all in favor? Any opposed? Okay, motion carries. Thank you. How about Dr. Casey?
Thank you, Ms. Fisher. We request approval of the routine credentialing activities for the month of September. That should be in your red packet. Applicants 1 through 93, including new appointments and reappointments. And
there's no problems or concerns that need to be discussed in
no
close?
concerns.
The appointments have been provided in your red folder. I'll give everybody just a few minutes to check over there and see if there's anything that we need to move into close. If no corrections or executive session is necessary, I'll ask for motion to approve.
Move approval.
Got a motion and a second?
Second.
Any opposed? Any further discussion? God, I'll get it together at some point. It's the sugar in the banana cake, I think, is getting to it. Is there any further discussion on the privileges? And I have a motion and I have a second. All in favor?
Aye.
Any opposed? Motion passes. Thank you. We'll move to committee reports and action. Dr. Holland is not with us today for this meeting, but Dr. DeBose, you've been promoted. Amanda's back. Sorry.
Back.
Vice Chair Amanda Arizola will provide the report and action of the Quality Patient Safety Committee meeting from August 12th.
Yes, thank you so much. The August 13th Quality Committee update, we had a patient success story where Dr. Kuthrapalli shared an inspiring video showcasing a successful multidisciplinary collaboration between pulmonology and ENT to treat a patient with a rare airway disorder. This patient was seen by multiple specialists in DFW and Houston who were not able to provide this life-saving treatment. We also had the Charles E. Weber Jr. Golden Mitt Award recipients. The emergency department was announced as the winner for their exceptional service and dedication to patient care despite seeing a high volume. And I attest to that. Our emergency department is amazing. We were just there with my sister a couple of days ago. So they're fantastic. The Joint Commission certified clinical programs. The Quality Committee received comprehensive presentations, including clinical outcomes by 3 clinical programs, patient blood management, acute myocardial infarction, and sepsis. These programs were recently surveyed by the Joint Commission. All 3 programs successfully completed their biennial recertification survey and were recertified without any findings, so good job. Quality reports, Dr. Bedmosi presented the quality assessment and performance improvement reports for behavioral health, radiology, respiratory therapy, women and infant departments, and operations, or hospital throughput, and antimicrobial stewardship committees. In addition, the hospital's performance on 2 external quality reporting programs, CHIRP and patient adverse events, were reviewed. The metrics for each department and program were analyzed, and most meeting their targets. Action plans addressing areas for improvement were also discussed and feedback provided. Upcoming presentations, an in-depth presentation by the Behavioral Health, Women and Infant Departments and Radiology teams are scheduled for subsequent Board of Medical Quality meeting to discuss their performance and strategies. And also we saw scorecards. So Dr. Badmossi provided an overview of the current scorecards to the board, emphasizing the status of hospital-acquired infections, both CATI and CalSub rates remain below target, while SSI rates, including those for colon and hysterectomy procedures, were also performing better than expected. Ongoing safety action plans related to PSI 4 and PSI 90 were presented, highlighting the continuous efforts to enhance patient safety and care quality across the organization. So this quality committee meeting was high pack and had some good reporting. So thank you.
Great, thank you. Now, Dr. DeBose, you may.
Thank you. The HR committee met on the August the 22nd, and staff did a great job of highlighting the accomplishments for they began the JPS Excellent Award, which recognizes employees for outstanding performance and contribution. It is time for us to do our annual survey that we have as a part of our annual performance, and so they have achieved a 76% overall response from staff, which is great. For clinical level participants, it's 50%. For part-time and PRN level participants at 43%. But that's still great because this was just started a few days, so that's an outstanding deal. So the Journey to Exceptional initiative is ongoing efforts to enhance JPS employment engagement through strategic measures aimed at fostering a culture of excellence. So that goes along with all of the excellence awards and keeping our employees engaged. As your employees are engaged, that means that you have a good work environment, and so they are performing well, and plus they want to be here, which is great. Staff did an update on retention. You know, we always look at our retention for voluntary turnover rate, and it's at 28.4%. And we had a goal, and where we wanted it to be, and we have exceeded that. We've lowered it. We've lowered it to more than we had anticipated, which is good. We had a question about internal transfers, and they looked at that to see how many stayed, and that looked very well. So for employees going from one area to another, they are looking at the exit interview data, so they're analyzing that. They're also looking at a better way to get data when employees leave. You know, employees that's unhappy sometimes will give you some information, but some of the others that don't, you really need that information. So they're looking at a way to get that and do continuing education. The reason for our departures on this data so far is career advancement, continuing education, personal reason, and family consideration. Those were the 4 higher spots that folks were leaving us doing the voluntary separation from our organization. That concludes my report. Anyone have any questions?
No, but I do have a little bit of an update. So as Ms. DeBose mentioned, we had just started with our employee engagement survey, and I think within the first day or a couple of days, we were already at 70%. So that survey has been completed. Over 95% of the staff responded to the survey. Over 80% of physicians, clinicians, last year I think we were down at 40%, responded to the survey. And for the first time, we decided to survey our PRN staff, and we knew that that would be a difficult one since they're not actually down here. Over 75% of them actually responded to the survey.
Great.
I have received a call from Gallup as to what those results are, and so we'll be sharing those with you, but we have exceeded stretch. Gallup has asked us how we continue to build on the strong engagement that we have had in place. Not only our employees, as you know, clinicians are surveyed differently because they engage differently than your other employees do. Also showed drastic improvements with engagement. Still a lot of work that will go on across the organization. We have released the results to the executives today, and they'll start releasing that down through the organization, and we'll bring that back to the board. But I'm very, very proud of the teams and the employees and our physicians here that every day come in for the right reason. So great job. Thank you.
That's a terrific number, 96%. I mean, you expect like 85% on a mandatory survey.
I think on average, high performing or survey is about 75%. So to have 95%.
Let me put it this way. It's either really good or it's really bad.
Yeah. No, I think it really speaks to the fact that they feel that there is a vehicle by which they can be heard, and not only heard, but actually someone is taking those survey results, their comments, and actually creating some action around them, and then communicating that back to the staff as to what we are doing in order to respond to what you see to be your needs. So I think it really does speak of the work that goes on around the organization.
Congratulations, Ashley. That's tremendous. Okay. That is all the items we have as part of the regular agenda. There is no consent agenda because everything was on the joint meeting held at the end of August. So we will take 5 minutes and we will go to executive session at 2:05. It is 4:06. We will reconvene in executive session. Thank you, board, for the extended time. We needed some time to discuss some important matters. Very few times does a board like this get to cast votes that are truly an honor. And in saying that, Reverend, I will turn to you for explanation and a motion.
Mr. Chairman, just based on
Hang on, Reverend, your microphone.
based on the involvement and commitment and work in the community and support Commissioner Roy Brooks has provided to JPS, and we know that he will be ending his term this year. I'd like to move that we name the building Medical Home Southwest after Commissioner Roy Brooks in honor of his many hours in service and commitment to the Tarrant County Hospital District.
Okay.
I have a motion.
Second.
I've got a motion and a second. Is there any further discussion? I think that this is a well-deserved honor and will continue to leave a legacy for the service of Roy Charles Brooks. With that, I've got a motion. All in favor?
Aye.
Any opposed? Motion passes. Thank you all.
Thank you.
We stand adjourned.